Hello guys, I'm Dr. Thompson. I am the instructor of the DeTsquare OET Academy. Today I'll be teaching you how you can organize your letters for both doctors and also nurses. Well, if you are joining us for the first time, I will plead with you to kindly subscribe to this channel. You can hit the subscribe button just below this video so that anytime I upload my videos, you'll be able to get alerts or notification immediately. Um, and I've actually done a lot of videos on writing, speaking, listening, and reading. So kindly go through my channel, my YouTube channel. You will get a lot of useful materials. And I've done a lot of work on this writing. And if you've gone through my channel, I don't think you have any. If you after going through my channel, I will assure you that writing will be very simplified for you. Without wasting much time, let's go to what we have today. So we'll be discussing organizing your letter. And organization and the layout of your letter, they usually go hand in hand. And for you to have a very beautiful letter, your work will be, you need to have a very good organization, both at paragraph levels and at sentence levels too. The way you arrange your sentences in each paragraph and the way you arrange your paragraphs, the order that they take. For example, now in OET, usually you may have an emergency case or a cold case. And the way you organize these two letters actually differ. Take for instance, for court cases, you can actually decide to start from social history, medical history, and all before coming to the timeline. That is the event that brought the patient to the hospital. Whereas if you are discussing an urgent case, you are not supposed to start from your maybe social history, past medical history, family history, and all. You are supposed to start from the events that that brought the patient to the hospital. The event might maybe the patient has visited the hospital up to 2, 3, or 4 times. So you are supposed to start from the very first time that the patient visited the hospital, if the information there is actually important for your writing. So what you are going to do basically today is to show you how you can organize your letter and how the layout of your letter should be. First, I will start from the doctor's case notes, after which we'll now go to the nurse's case notes. So let's go now. Let's take this case note for instance. So this case note is a case note of Angela Jones, and that's the age and all the information in this case note. If you've been following me, you know when in my previous tutorials, I actually advise you whenever you have a case note, the first thing you are supposed to do is to first of all go to the writing task. The first thing you are supposed to do is to first of all go to the writing task. So, and for you to organize your letter very well, you actually need to select appropriate information to get valid information that the addressee will require for the letter. And after getting this information, then you now organize them in a sequence that will flow perfectly for the addressee to understand the information that you're trying to pass across. So what we do first is first of all to go to the writing task, and from this case note, you are writing to this is actually a referral letter to Dr. Philip, and this Dr. Philip is a casualty officer at Emergency Department, Marisol Hospital, this address. So from this case note, we've actually seen that the letter we are writing is a referral letter, and the person we are writing to is a doctor, and the doctor works as a casualty officer. That means this letter most likely is an emergency, because we are writing this letter to the emergency department. So after reading the writing task, the next thing you are not supposed to do is to go to the last visit. Go to the last visit, specifically your diagnosis and treatment. And from here now, the treatment that was given is this, and we can see that we are suspecting that this patient has pneumonia. So most likely it's because we are suspecting this patient has pneumonia. That's why we are sending this patient to this doctor for this doctor to see. Now we've already known that what we are dealing with is actually we are suspecting that this patient has pneumonia, and whatever information we are going to be selecting will be around pneumonia. Then what next we are now going to do is now to go through this letter from the beginning to the end. So you now go through this letter, and if you actually go through this letter, you will discover that, okay, the first visit, okay, this patient has asthma. The first visit that the patient, we are suspecting of upper respiratory tract infection, and we are suspecting of upper respiratory tract infection, and the diagnosis made then was upper respiratory tract infection, and as we also suspected that the patient has acute exacerbation of asthma. So, and this patient visited again on the 20. This patient visited again. Okay, yeah, 23rd. This patient visited again on the 25th of June, and our diagnosis again is infective exacerbation of asthma. That means this patient has actually been having asthma. Then on the 28th, which is today, that we are seeing the patient, then we are now suspecting, this might be pneumonia. So what are we going to do? What we are going to do now is to select appropriate information that we are going to use. That means all that we are going to be talking about will tailor around asthma and pneumonia. Anything outside these two that will not help this casualty officer to manage this patient, we are not going to add it to our letter. So we go. Now, usually we'll add patient's name and address. I highlighted it in red. So those information that we are going to add, I will highlight them in red. Occupation, administrator. This information is irrelevant to the casualty officer. Patient is single. It's not relevant to the casualty officer. It has nothing to do with it. It will not help the patient. It will not help the casualty officer to manage his patient. Past medical history. Well, patient was diagnosed of asthma in 2002. That's why I selected this one. And hypertension 2003. Well, we are sending this information to this patient to casualty officer because we are now suspecting that this patient might have pneumonia, and hypertension has no link with pneumonia. This is a casualty officer, probably to stabilize this patient and discharge this patient. So this is a chronic illness that this patient has been having, so it's actually irrelevant. Appendectomy, it has nothing to do with the patient treatment. Depression, it also has nothing to do, and it was even a long time ago in 2010. It has nothing to do. Patient also has rib fracture in 2011, which would have, and here we are in 2020, this rib fracture would have resolved. Patient is a non-smoker. Anyway, it's not relevant to us if they say patient is a non-smoker. If this patient were to be a smoker, then we'll add this information. Medication, patient is on salbutamol for this asthma, so we'll add this salbutamol. It's on amlodipine and also on ramipril. These drugs are not necessary, are not relevant to us, so we'll exclude them because they are used for treatment of hypertension, and we do not even have hypertension in the first place. Now, anything that the patient is allergic to, no matter which condition you are dealing with, whether you are dealing with depression, you are dealing with any case at all, always add the history of allergy if the patient is allergic to anything. But if the patient is not allergic to anything, maybe they say no known drug allergy or any allergy, there is no need. Writing that statement is irrelevant. But here, our patient is allergic to sulfonamides and dust, so we'll add it. Then the first visit, patient came presented with these symptoms. We are going to add all. Now they said no SOB, new weight loss. Now, you see, for you to OET writing, to be honest, you knowing English is not enough for you to organize your work and select appropriate information. You really need to have a medical background. That's why if you have somebody that teaches English, but the person is not really a medical doctor, it will actually be not really a medical doctor, a nurse, or any health professional. It will actually be difficult for him or her to organize your work, to select appropriate information that will be required for your OET writing. Now look at this place. Now this patient presented with cough, runny nose, fever, wheeze, and chest pain. And looking at the assessment that we made that very day, we made an assessment of upper respiratory tract infection and also acute exacerbation of asthma. Now history of cough, runny nose, fever, wheeze, chest pain, all associated with these two. Now they said no shortness of breath, no weight loss. Now this patient does not have this, so I don't really see any need we adding it. You telling there is no shortness of breath, this shortness of breath and weight loss is irrelevant, so it's not really necessary. You've gotten the positive symptoms or positive history, you add them and forget about the normal or negative ones. So we are excluding this. Then from our examination, this temperature is not okay, we'll add it. This pulse rate is okay, blood pressure is okay, respiratory rate is okay, we ignore them. Nasal congestion, we'll add it. Tonsils swollen, and the swollen tonsils, and they are also reddish, meaning they are inflamed, we'll add them. No exudates, no use of accessory muscles to breathe. So they say they are not present, so no need adding them. Widespread wheeze, we'll add it. No crepitations, we will not add it. Then the assessment we made that very day is upper respiratory tract infection, and we'll give this patient salbutamol inhaler, and we'll add it because that was the treatment. Then excuse duty at work for 1 week. We are referring to an emergency to a casualty officer. This story that you gave the patient excuse duty is irrelevant to the casualty officer, so we'll ignore this statement. So you can now see for this first visit, which is the beginning of our timeline of these patients, we selected the relevant information and we excluded the information that are not relevant. Now, that's for our first visit. Let's go to the second visit. Now, let's look at the second visit. The patient now visited again on the 25th of June with shortness of breath, worsened on exertion. Initially, this patient didn't have shortness of breath. Now, this patient has shortness of breath. So we will include it. Continuous wheeze. Patient had wheeze before, and the patient presented with wheeze. So I highlighted this one. This one I highlighted on green, meaning I'm not going to be repeating all these symptoms again because I've listed them before. Repeating those symptoms again means that your vocabulary range is actually very, very restricted. So there's really no need you repeating the symptoms that you've listed before, but you can summarize them or even call them symptoms. Yellowish sputum production. This patient didn't present with this before, so I highlighted this. I'm adding it now. And from our examination, patient was febrile before, no needs repeating this again. So I will just summarize it or paraphrase if necessary. These vital signs are okay, they are irrelevant. Tonsils swollen and reddish. That was the initial presentation, so no need repeating this again. So these are the mistakes that some candidates make. Sometimes after repeating a particular symptoms, they will still go on and continue repeating. So if you are repeating all those things, it actually means that you don't really have a vocabulary and don't really, the organization, it also affects your organization. Use of accessory muscles of respiration. This patient didn't present with these symptoms before, now is coming down with it. Widespread wheeze, no crepitation, we will not add this. So effective exacerbation of asthma, just like our previous diagnosis, no need repeating it again or saying the previous diagnosis was made again. It's irrelevant. So the treatment now, these were the treatments we gave before. There is really no need. And besides, this was the treatment that we gave before. There is no need repeating it again per se. Even if you were to repeat it, you have to paraphrase. But I decided to remove it, not to add it. But the new treatment I now gave, I prescribed the amoxicillin and the prednisolone. Well, some students, some candidates add dosages. I think they are actually irrelevant because every doctor has what we call BNF, and most doctors or health workers, they know the right dosage or right prescription for a particular drug. So when you are referring to a health worker, there's actually no need you writing the dosages of the drugs. Just list the drug, amoxicillin and prednisolone. On the other hand, if you're now referring this patient to somebody that is not a health worker, maybe a psychologist or any other person that is not a health professional, then there is need for you to like let this patient know the appropriate dose before such addressing or the person will go and overdose your patient. So now today's presentation, patient was rushed in with shortness of breath. Because of this rush in, we'll add it, meaning that this shortness of breath has actually worsened. We've listed these drugs before and these symptoms, so no need repeating them again. We can paraphrase. Difficulty breathing and all that, use of accessory muscles of respiration, we documented them before, no need adding them again. Widespread wheeze, basal crepitation. By basal crepitation, we can add this widespread wheeze. I think we've added it before. You need to now paraphrase here. No need even repeating this. Then our assessments, we treated this patient, no improvement. We treated for over 30 minutes. We've given a lot of, we've nebulized this patient maybe 2, 3, or 4 times, yet no improvement. So we are now suspecting that this patient has pneumonia. This cannot be asthma any longer. That's why we are referring this patient to emergency, to the casualty officer. Now you've selected your information. The next thing now you are now going to do is to organize this information, how they are going to be. Now your paragraph 1 should be your introduction. And if you've gone through my previous tutorials, I told you what should be in your introduction. Your introduction should contain only 2 sentences. Let me not say only 2 sentences, at least 2 sentences. You don't use a 1-sentence paragraph for your introduction. Should contain at least 2 sentences. And these sentences should, number 1, contain what you've done for this patient. That means the diagnosis and the progress of this patient so far. Then secondly, your introduction should contain what you want the addressee to do for this patient. So these are the 2 sentences that should be in your introduction. There's really no need writing irrelevant details in your introduction. By reading your introduction, the casualty officer should be able to know, even without going through all the things that you've written, should be able to know what you actually want, what is wrong with this patient, and what you want him to do for this patient. So that's how your introduction should always be. Now, after writing your introduction, now this is an emergency. Ideally, we are supposed to start from the timeline, and the timeline started on this date. Some persons are confused. They might think that starting from the timeline means you starting from today's event. It doesn't mean starting from today's event. It means starting from the sequence of events that led this patient to the condition that the patient is having now. And this event started on the 23rd of June. So that's where we are supposed to start. But if you now look back, you go to the medical history, you discover that this patient was diagnosed of asthma. And asthma is directly linked to what we've been suspecting this patient, managing this patient for, which is acute exacerbation. So actually, we're actually dealing with asthma. So it will be ideal, instead of you starting from this first visit as your second paragraph now, you are supposed to now start from here as your second paragraph. After using this one as your second paragraph, the visit of 23rd will be your third paragraph. Now, for each event, to organize your sentences, you start from the presenting complaints, followed by symptom, followed by clinic signs. That's your examination, followed by investigations if there are investigations, and then followed by your assessments, and finally your treatment. So this should be the sequence of your write-up in each paragraph. So for this event of 23rd, you start from your symptoms, the symptoms the patient presented with, followed by, you start from the symptoms, followed by examination, followed by, okay, here there is no investigation. Investigation would have come before your assessments, then followed by your treatment to make your third paragraph. Now, your fourth paragraph will now be the event that happened on the 25th. So for the event that happened on the 25th, you start from symptoms again, examination, assessment, and treatment. That's the order that it should always be. Don't start from history. Don't start from history and then go to treatment and then come to examination and then come to assessment. That's disorganization. So your work will be disorganized. So you have to arrange it sequentially this way. Even if this information are not arranged this way, you should arrange it in this order. So this should be your fourth paragraph. I say first paragraph introduction, second paragraph the medical drug history, and then the allergy history will be in one paragraph, making it the second paragraph. Third paragraph, event that happened on 23rd. Fourth paragraph, events that happened on 25th. Fifth paragraph should now be this event that happened today. Then your sixth paragraph should be your concluding paragraph. Then where you re-emphasize the purpose of this letter, that's your concluding paragraph. Then your seventh paragraph should not be, please contact me if you have any questions and all that. That's a long sentence. Usually that seventh paragraph is not added as your word count, and but you should always add it to your letter writing. Now, from my observation so far and from my knowledge so far, from what I've read and discovered, for you to have a very good layout in OET writing, your letter writing should not be less than 6 paragraphs. It should always be between, and should not be more than 7 paragraphs. It should always be between 6 paragraphs and 7 paragraphs. That means introduction, from this one now, introduction, first visit, second visit, today's visit, concluding paragraph, and then please contact me. Okay, introduction, that's social, and let me go back. It should be from introduction, then this history, which is second paragraph, this one, third paragraph. If third, that's first visit, second visit will be fourth paragraph. This should be fifth paragraph. Concluding paragraph will be your sixth paragraph. And please contact me if you have further questions, further queries will be your seventh paragraph. Well, occasionally there are some times that you just have a case note where you just have only one visit. When you have such case note, the layout most time will be either 5 paragraphs or 6 paragraphs. That's the only time you can have a layout of 5 paragraphs. Otherwise, whenever you have 2 visits and above, your layout, your paragraph should be at least 6 or 7, and should not be anything more than 7, should not be anything less than 6. When you have 5 paragraphs or 6 paragraphs, it's only when you have just one visit. Now, after organizing your letter, the next thing you are now to do is to write this letter in full. Now, let's see how I wrote this letter. Now, this is how I wrote this letter. Look at the address. If you don't know how to write address, go back to my videos on how to write address, date, greeting, and the heading. So I've written the address. This is the address, this is the date, the greeting, the heading, and then look at my introduction. Thank you for seeing Miss Joan, who has been suffering from asthmatic attacks and currently being suspected to have pneumonia. So that's the first sentence I told you that would describe what you've done for this patient, the diagnosis and the progress so far. So this patient has been suffering from asthmatic attacks, but now we are not suspecting that this patient has pneumonia. That's my first sentence. Then second sentence is, she would require your evaluation and further treatment. Or you can make this statement to be, she's being referred to you for further evaluation and treatment. It's cool. So these are the two information that will be in your introduction. Now, let's look at my second paragraph. You see, I'm leaving line for each. After my introduction, I will also leave a line. That's a line paragraphing. So let's look at my second paragraph. Miss Jones was diagnosed of asthma in 2002 and has been on salbutamol inhaler. She is allergic to sulfonamide and dust. Full stop. So those information that I highlighted, I turned them into sentences. So that's my second paragraph. Now my third paragraph. Where will I keep this now? Okay, let me just leave it here. My third paragraph now. This is the events, all the events that happened in the first visit, both the symptoms, the clinical findings, treatment, and assessment. So let's see. On 23rd June 2020, Miss Jones initially presented with fever, running nose, dry cough associated with chest pain, and wheeze. That's the symptom. On examination, she was febrile and her tonsils were inflamed. I didn't talk about they were reddish and all that. I'm converting them into sentences. I did not even write the whether it's 37 point something. I just say she was febrile. So I'm writing to a doctor, so I should use medical jargons. On examination, she was febrile and her tonsils were inflamed. I didn't use reddish. Inflamed is a medical jargon. Therefore, she was diagnosed of acute asthma precipitated by viral upper respiratory tract infection. They listed two diagnoses. I combined them because they're actually linked. That's why your medical knowledge is actually very important in writing OET. It's not just about you writing English or knowing how to speak English. The dosage of a salbutamol inhaler was thereby increased. So first sentence, the symptoms, second sentence, examination, third sentence, the diagnosis the patient was made, and my last sentence was my last sentence I talk about the treatment. So you can even merge the sentences, making them more complex, which is actually would be admirable. Then this is my third paragraph. Now my fourth paragraph. 2 days after, I've written the dates here. Instead of me saying on 25th, 6th again, it will look as if I'm writing like a baby. So you have to paraphrase these dates. The second date now, and I say 2 days after because it's on 25th. 2 days after this, Miss Jones was seen with worsening signs and symptoms. Now, if you look at here, I combine things. I've also paraphrased. Instead of repeating all this fever, this, because they were actually worsened. I say worsening signs and symptoms. Evidence by shortness of breath. I'm not introducing what I've not written before. I didn't document this symptom before. Evidence by shortness of breath, production of yellowish sputum, and the use of accessory muscles of respiration. She was then treated with amoxicillin and prednisolone. That's my fourth paragraph. So let's go to the fifth paragraph. Fifth paragraph, Miss Jones was rushed in today, still having shortness of breath with widespread wheeze and bibasal crepitation. I've not mentioned these symptoms before I introduced them here. There was no sign of improvement after a series of treatments. As a result, a probable diagnosis of pneumonia was made. Now, my concluding paragraph. In view of the above, I believe Ms. Jones would benefit from further investigations and more aggressive management, hence the referral. Now, if you look at this, my concluding paragraph, I try to re-emphasize the purpose of this letter. And the purpose of this letter is for this casualty officer to further investigate the patient and aggressively manage this patient and manage this patient. You can see it's like a paraphrase of what I wrote in the introduction, the purpose in the introduction. So that's the sixth paragraph for you, which is my concluding paragraph. Then my seventh paragraph will now be, please contact me if you have any queries. Just copy and paste. There's really no need you trying to beautify this statement, because this statement, they don't add it as your word count. Your word count started from the introduction to that concluding paragraph. So this statement is not actually counted in your word count. So no need trying to just copy. Please contact me if you have any query. Copy it as the last paragraph and post. And this statement should always be on its own as your last paragraph before your closing remark. Yours sincerely, Doctor. Ideally, there's supposed to be full stop here. It was a mistake, so you add full stop here. Yours sincerely, I left a space before Doctor. So that's the full letter for you. So just carefully go through the case notes and the way I constructed this letter and organize this letter. It has a beautiful layout. It has a beautiful organization, both in paragraph level and as on the whole letter as a whole. So what we are going to do now, we'll take another case notes. This time around, we look at the nurse's case note. If you're a doctor, don't say, oh, what am I doing with the nurses? You can learn one or two things from the case note too. The second case note we are going to write now. We are going to organize this letter appropriately. And this case note is for nurses. Now, if you look at the case notes, I remember what I told you. Whenever you are dealing with any case, the first thing you are going to do is to first of all go to the writing task. So we are not starting from the beginning. So we go to the writing task. So the writing task says, using the information given in the case notes, write a letter to the community health nurse outlining patient history and requesting ongoing monitoring. Address this letter to community health nurse, Rayfield Community Health Center, this, that. So we are writing this from the writing task now. We know that we are writing this letter to a community health nurse, but we don't know if this is a referral letter, discharge letter, or a transfer letter. So we go a step to the last visit. So here now, from this place now, we discover that this is a transfer letter to the care of the community health nurse in Newton. So we're actually writing a transfer letter to this healthcare worker. Some persons, the mistake that they make, any letter they are writing, they will always think it's a referral letter. The letters are actually similar. The pattern you write them is actually the same, but the truth is that there are subtle differences. I'm not going to say I'm writing to refer. I'll say I'm writing to transfer. So this is a transfer letter. We are transferring this patient. But most likely this patient, okay, agree to live with this. Son will be in charge of mother advice on patient is still not adherent to this. So agree to live with son at Newton. Let's see where this patient was living before. So let's start from the beginning of this letter. So let's see. This is the patient's name. Okay, this is the primary center at Brisbane. So you are a nurse. So most likely this patient has been in Brisbane. The patient has been attending this primary health care center. And this is patient details. So we'll add this. So what we're going to do, and from what you can see from treatment record, this patient is diabetic and blah, 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 blah. So let's see what we are managing this patient for. Okay, diabetes. So that means you're actually managing this patient for diabetes. So what you're now going to do is to select information that will help this nurse that we are transferring this patient to monitor. Remember, we are requesting for this patient to monitor and also support this patient. Do you understand? We are transferring this patient treatment care to another hospital entirely. So we are writing to this community health nurse so that he or she can monitor this patient. So what you are going to do now, let's select the information that we are going to use to write this our letter. So to select this information, we always add the patient's name and this in the marital status. Patient is widow with a son. Well, the nurse will be monitoring this patient, and we are telling that the patient is a widow and has a son. Some persons might decide to add this information, but this information is not absolutely relevant. At the same time, it's not absolutely irrelevant. So, but I decided to remove it. It depends on how you add this information that will determine. But telling the nurse that this patient is a widow and all that, remember this patient has diabetics, so to be monitoring this patient is not absolutely important. So let's go to the current medication. The patient is on these drugs, so we have to add. Remember, we are writing to a health worker. That's why I didn't bother writing the doses of this drug. So I'm not going to add them. Treatment record. Let's see how many times this patient has actually visited. This patient has visited 1, 2, 3, 4, 5, and several visits here, 6, and then 7. This patient has actually had multiple visits. This patient has had multiple visits. Now, if you want to be writing this letter and be writing each visit, you will just cause problem for yourself, number one, and you have you will not be your letter will not be concise, and you add a lot of irrelevant information. So what you are going to do first, let's select the information that are relevant and then decide on how to organize this information. Well, I remember the argument that was in my group, in my academy one time. The nurses and the doctor, they were arguing in the group, which letter is more difficult. So I have to settle it for them. To be honest, the writing the nurse's tax, I think, is a little bit more difficult than the doctor's tax. But if you understand how to organize your letter and go about writing, the pattern is still the same. Whether you're writing, you are a doctor, you are doing your writing, you're a nurse, you're doing your writing, the pattern that you still follow is still the same. So here we have multiple visits. So there's still no need writing all these visitations and everything here. We really need to do a good work here to come up with a good letter. So let's go back. We've selected this. The first visit, yeah, that's when it was established that this patient had diabetes. So we have to add it. The fasting blood sugar was done on 2 occasions, and these were the values. So this information is irrelevant. This was done in 2018 and to help for this diagnosis. So there's no need telling this nurse the value at that point. So it's irrelevant. GP recommendation, he recommended all this. So it's actually relevant to control this diabetes. Lives alone but has a cook. Well, I think this information is irrelevant. We are not dealing with a social worker here. So it's irrelevant. If you are writing to a social worker, we will not ignore this information. In 2018, the patient presented again. Okay, daughter deceased. Okay, the daughter of this patient died in 2018, and patient grieved, and we now went back to the GP. The blood sugar was checked, was higher than this, and the patient will commence on metformin. So this history of grieving the daughter's death and all, they are irrelevant in this case. This is 2018. It takes 6 months for grieving. Anything outside 6 months is no longer grieving. No. It's now a psychological or psychiatric issue. That means the patient should be referred to a psychiatrist. But here we are not referring to a psychiatrist. We are not transferring this patient to a psychiatrist. We are transferring this patient to another community health nurse. So this information is irrelevant. But here we can add this information because this blood sugar has increased, and we'll commence this patient on this. Now let's look at in July. In July, the patient came not adherent to dietary restriction, misses this. So all this information actually irrelevant because they are centered around the diabetics and what we advise this patient to help her manage her diabetes. The next visit again, patient now came with was even hospitalized. This patient was hospitalized and because of diabetic food. The patient even had sepsis with fever, confusion. The debridement was done, and this MCS was done. Pseudomonas culture, blood culture, Pseudomonas aeruginosa culture, treated with ceftazidime and amikacin. The patient's right foot was amputated. Patient recovered and discharged home on crutches. Now, this happened in 2018. We are in 2020. Telling this community health nurse that the patient had sepsis was the Pseudomonas was. So this information, they are all irrelevant. Just tell this is a complication, we'll bring it out. This patient has lost his, which is a very important information, we'll bring it out. All these other information, they are irrelevant. In January 2019, this patient was hospitalized again for another complication. Here, he came with retrosternal pains, vomiting, and shortness of breath, and MI was suspected. ECG confirmed this, and we treated this patient. Well, this is another complication. We list it. The things that we did for this patient at that time, which they've been completed. This information, the symptoms that the patient presented with, they are irrelevant. ECG confirmed. We can say that these patients have myocarditis is a complication. We've already added it. No need flogging around the treatments and the ECG and all that. So you adding all these other information will be regarded as irrelevant information. So now, patient from 2019, January 2019 to December 2019, patient was coming to the clinic, was followed up twice weekly. No need for this information. It will not help the nurse to monitor this patient. So patient came again in March 2020. Poor exercise intolerance. You commence exercise now. You no longer tolerate it. Restricted mobility despite walking aids. poor nutrition, non-compliance, you add discussed dietary, alternative food delivery, community meal delivery services. Remember, this patient is only leaving this community and going to another community. So this information is actually irrelevant. So we ignore it. Patient was hospitalized again 3 weeks ago, severe skin due to severe skin infections, and was treated with this. So as we mentioned before, this information, what the patient was treated for, the drugs we use to treat the complications here, to me, they are irrelevant. So we are re-emphasize the need for drug and dietary compliance, which is also relevant to added it. So you can now see this patient has had 3 complications. The first was diabetic foot, second was myocardial infection, and now severe skin infections, all because of, as we know, this patient has not been compliant with them. Due to poor compliance, these patients have developed all these complications. So your medical knowledge is always very important in your OET writing. So add all this. Today now, the patient now came. The patient decided to move with the son. That's why we are adding this. Son will be in charge of mother's meal and all that. So all this information is still not adherent to lifestyle. We've flogged this issue over and over. That's why I'm not adding it here. Patient to commence physiotherapy, require monitoring and encouragement. That's even why we are sending this, transferring this patient transfer. So these are the information we are going to use. All these ones highlighted in red. So now, after selecting your information, the next thing we are going to do now is to organize this information. Now, let's see how I organize this information in this letter. Well, see how I organize this information in this my letter. This is my address. This is the pattern of data I use here. I repeated it here. If you are still confused of how to write all these things, you go back to my previous videos on this. There are 4 parts there. So just go back. Then now look at how I organize this letter. Look at my introduction. I'm writing to transfer Mrs. Lodson into your care for monitoring and support. That's actually the reason why we are transferring, the purpose of this letter. Then what have you done for this patient? She has been suffering from diabetes and has had several complications. See how I summarize things? So that's all for the introduction. We go to the first paragraph. Now, Mrs. Lawson was diagnosed of type 2 diabetes mellitus in January 2018. She was then commenced on dietary restrictions and lifestyle modifications. However, her blood sugar continued to rise, most likely due to non-compliance to the recommended nutritional changes. As a result, she was started on metformin. I combined the first 2 visits now to get this paragraph. So those important information I selected there, I combined them to get that paragraph. So let's go to the 3rd paragraph. The 3rd paragraph are now set 6 months after from the initial visit. Now 6 months after, Miss Lawson was still not compliant with her dietary regimen, and she occasionally missed her medications, which she attributed to memory failure. She always says she forgets things. So she was counseled on the complications of her condition and was also advised on memory aids. So you can see how I'm summarizing my information without listing things, repeating things all over again. So let's go to the next paragraph, the 4th paragraph. Now, all the complications that these patients had, the diabetic foot ulcer, the myocardial infarctions, and then skin infection, I summarized them in this paragraph. Subsequently, Mrs. Lawson suffered from several complications following poor glycemic control. She's currently using crutches to ambulate as her right foot was amputated. So that's just the summary of the whole. There's no need telling this community health nurse everything. The significance of all this complication was this amputation of her right foot. So, and she had all this complication because of her poor glycemic control. So this woman should be aware, so that she also monitor this patient very closely before she develops another complication. Now, today, Mrs. Lawson was seen and she decided to live with her son in Newton, who will be taking care of her. Please educate her son on the need to modify patient diet, encourage drug compliance, and consult a physiotherapist. It is worth mentioning that Ms. Lawson is currently on lisinopril, metformin, warfarin, and sotalol. Now, I added this transitional phrase, it is worth mentioning, before adding this medication history, because in this paragraph I was just discussing about event that happened today. All of a sudden I'm talking about medication history, so I have to add this transitional phrase so that I can link this medication history to suit the idea I'm having in this paragraph. So the concluding paragraph, in view of the above, I believe Ms. Lawson will benefit from your continued care. I didn't repeat monitoring and support again. In view of the above, I believe Ms. Lawson will benefit from your continued care. Kindly take over her management. We are transferring this patient. You will no longer be involved in this patient management. That's why we are asking this community health now to take over her management. Then the next paragraph, if you have any queries, please contact me. Simple and short. We used yours faithfully here because this patient, we don't know the addressee's name, and then nurse. So that's basically how to organize your letter in OET. Now, with you, I think if you actually take time to go through my channel and view all my videos, you can actually write this letter. Any OET letter, you can write it at ease, even in less than 30 minutes. Just take time, go through my channel, you will get all the information that that will be beneficial for you to write this letter. Well, if you now think that after going through my channel, you are still not, you still need somebody to assess your letter, I render those services, but with some fee. So you can contact me, you can reach me on this you can reach me via my email address. You can contact me on Telegram or WhatsApp using this. Please, if you've not subscribed to my channel, kindly just hit the subscribe button, like this video if you actually appreciate it, and also share to others that would like it. Thank you very much. I wish you all the best in your exam. I will continue to upload more videos to help you guys pass your exam at ease. Bye.